You can go ahead and start putting names and orgs in the chat box, please. Thanks. Thank you, Liz and Jessica. If the rest of you will start putting your name and organization in the chat box, we'd appreciate it. That way we can keep some attendance. Thanks. Thanks for being here, guys. We got about 5 minutes. We'll probably have to start in 6 minutes. We'll start at one after. If you haven't already, put your name and organization in the chat box, and then we'll get started. I'm still looking for our guest speakers for today, but I'm sure they're on their way in. So thanks. I see one of our speakers today, so yay. If everyone can please put your name and organization in the chat box, that will have a record of everyone's attendance. That'd be great. Hey, Ms. Jones, do you have any slides you're going to need to show, or are you going to pretty much talk through it?
Yeah, just talking through it.
Okay, cool.
Mhm.
We'll have a slide with your organization name on it, so we're good. Yay.
Thank you.
Yep. Is Miss Claudia going to be able to join us today?
I am not sure. She's with the FNet program, so it's different programs. So I'm not
Yeah.
for certain. Mhm.
Okay. All right, we've got about 3 minutes and we'll get started. We usually start about 1 minute after. Hey there, Miss Terry Edwards. So glad you could be here today.
Hey Pat, hey everybody, I'm happy to be here. It's raining cats and dogs up here.
Yeah, it started to pick up over here now too.
Yeah,
It'll be pouring down rain just in time to go home.
that's right.
We are recording the meeting already. We've already started recording. So we'll go ahead and we'll send out the recording of the meeting to everyone.
I'll be questioning each of you. So, to take a while, so I put you back to oh, I want the units at the headquarters. Please have a look at something because you know what I mean. You know what I think I can with this? You're probably gonna need some sort of clearance though. It doesn't have to be the highest. It's just not even one of those banks that keeps detectives. I'm not limited to disclosing information about classified documents. Perhaps if you want to go back in time, there's a lot to say. Real investigators, then we can talk like so bad.
All right, we'll get started in 1 minute. If you have not already done so, please put your name and organization in the chat box. Thanks. All right, I'm going to go ahead and pull up our slide so it can be ready on the right one. Let me do this. Close out these other tabs here so it doesn't keep buzzing. And we'll quickly go through, and I mean quickly go through introductions, and then we'll get moving. We have a good list on the chat of who's here, but it looks like Coach Brown, it looks like you're my first up on my screen here, so you get to say hello first, who you are and where you're from. You're muted, Coach. All right, Tarika, we'll go ahead and skip over to you, please. Tarika?
Yeah.
Okay, can you hear me now, Pat?
Yeah, there you go, Coach. Okay.
Thank you. Happy New Year, everyone. Glad to be here in 2024. Wishing everyone good success and prosperity.
Okay, and Coach, tell me where you're from, please, your organization name.
Mother Mary Mission Incorporated, Phoenix City, Alabama.
Thank you. Okay, Tarika, now you. Can't hear you, ma'am.
We have a bad connection.
Okay. That's Tarika from Home for Good. Jessica, you're next.
Can you hear me?
Yeah.
Yay! Jessica Martin, United Way, Home for Good.
All right, Miss Terry Edwards. You're muted.
Ha, unmuted.
There you go.
Terry Edwards, Harris County Family Connection. Hi, everybody.
All right, Jessica over at CVEM.
Hi, I'm Jessica Camp, Chattahoochee Valley Episcopal Ministries.
Miss Liz.
Hey, Liz is with the Helping Lydia, but it's
Okay.
Liz from Southwest Housing.
Else you go ahead too now.
I'm Dallas Tor from Southwest Georgia Housing Opportunities.
Welcome, welcome. Thanks. Jamie Lee.
Hey everybody, Jamie Lee Pierce, Safe House Ministries.
Tiffany.
Hey y'all, Tiffany Cole with the House of Time.
Hey, Tiffany. You're listed on the screen as JMac.
Hey Pat, it's Jerika. Jerika
Oh,
McCrary.
hey, Jerika.
Yeah, just leaving another meeting, so can't wait to dive in to listen to what you have to provide today. Happy to be here. Thanks so much, Pat, for everything you're doing with Home for Good. But I'm with United Way with the poverty reduction.
Thanks, Jerika. Miss Andrea. Okay, we'll come back to Miss Andrea. Miss Jones, I'm gonna let you go last. So Kenyetta Plummer. Okay, Kenyetta, we're gonna skip you then. Charles.
Charles Jeffries, United Way Home for Good.
Miss Hall. Christine.
Hey, this is Christine, Housing Authority of Columbus, Georgia.
Thanks. Melinda.
Trying to work all this stuff. Hello, everyone. Melinda Schamberger, Chattahoochee Valley Episcopal Ministry.
Ivrea Hampton.
Hi, good afternoon, everyone. I'm Ivory Hampton with Volunteers of America, Region 6 for Georgia Housing Voucher Program.
Welcome. I'm sorry I messed up your first name. I'll get it right next time, I promise. Miss Keisha.
Good afternoon. It's Keisha Cawthorn with the Department of Behavioral Health. Happy to be here. Thanks.
Sam.
Sam Page, and I work with Keisha.
Latoya.
Latoya Davis, and I work with Keisha and Sam.
Woohoo!
Woohoo! Region 6 representing.
Chloe.
Hello, Chloe Landreth from New Horizons Behavioral Health.
Miss Devlon.
Hey, it's Dallas again. Devlon's having audio problems from
Well,
Southwest
welcome,
Georgia
Devlon.
Housing.
Dallas, you're the unofficial official spokesperson now. There you go. Mary Johnson.
Hi, I'm Mary Johnson with the Pastoral Institute.
Okay. And Crystal? Kenyetta from Corporate Compliance Officer at New Horizons, says her audio is not working. So Krista Feliciano is from Open Door. All right, Miss Jones, we're gonna do one little quick thing we need to do on a monthly basis, and then we're gonna let you introduce yourself and talk about the Cooperative Extension Service. Let me go ahead and share my screen. If I missed anybody, now's a chance to holler. Can everyone see the screen? Somebody just say yes, please.
Yes.
Yes.
Cool. All right, cool. All right, looking at referrals, we were 544 referrals in coordinated entry for the month of February. That does not mean 544 independent phone calls. That means 544 interactions of some kind. Now, remember, some of those may be 2 and 3 interactions with the same person. We're trying to drill down to find out what is the average number of interactions before the referral happens. But that's taken a little bit of digging down through. But over half of those interactions were referrals back to coordinated entry. As you can see here, 308. So over 50% were referred back to coordinated entry at least one time. And that's significant because the more times we have to go back and forth, as all of us know, the more likely someone is to drop or fall through the cracks. We have a HUD technical assistance request in. It has been approved. It has not been assigned yet for coordinated entry. So our community will be getting some technical assistance from a HUD TA provider to look at our current policies and procedures and tell us how to take it to the next level and improve the process, hopefully for providers, but more importantly for clients. So we have to, yes, go.
Sorry, can you change the screen so we can just see the slides? It's showing really small. Like we're just, it's like a slideshow.
I will try
Yeah,
again. Let me try again. Is that better?
Yes, thank you.
Sure. Yep. Okay. So, again, 544, and then, as you can see, that 100 and let me move my little thing here. 308 were ones that had to be re-referred back to coordinated entry. So any questions on that before we go? And we're going to listen to or have a discussion with Ms. Jones from the University of Georgia Cooperative Extension Service to talk about how we can help our clients with some of their other than housing needs and make connections with partners who can help with improvement of overall quality of life. So right now my slide doesn't want to move. There we go. All right, Ms. Jones, if you will, I'm going to, since we don't have any slides, I'm going to stop sharing so we can all have a discussion and look at each other. So take it away.
All right. Well, good afternoon, everyone. I'm Valencia Jones, and I am the program manager with under the UGA Extension umbrella with Healthy Families Columbus, which is a parenting support program. I have added our parenting support flyer in the chat. It should be loading soon. And as far as the extension, we have 3 different areas that we cover. We have family and consumer sciences, and we have agriculture and natural resources and 4-H development. And then we have Georgia Home Visiting. So you may be familiar with the 4-H program. We are in the schools. So we pretty much are supporting the youth development, supporting kids with school-based programs. And they do a variety of things throughout the year. They can apply for scholarships and travel around the world. And so if you were interested in that, we have a 4-H agent that is locally here in our house, in our office. We also have the Family and Consumer Science program, and they typically do food and nutrition, food safety, food preservation, and financial management. We are currently down that person right now, but we do have those expanded food and nutrition program, and that's Miss Claudia Calal. And she would be the one who would be the point of contact to support in that area for food preservation and nutrition. The agriculture, we are currently hiring for that role as well. We have a Master Gardener program, and that's a volunteer program. And our agents are here to help you realize the health and economic benefits of gardening for homeowners. We have soil and water testing. We have gardening workshops. And we have just a lot of things for the agricultural field. So those are the areas of that are housed under the UGA extension. We've just recently moved new locations. So we are here on 1111 First Avenue. And just to kind of dive deep into what I do as a program manager for the parenting support programs, we support families that are prenatal all the way up to age 5. And we try to go into the home. It is a one-on-one home-based service, and it's long-term. And we have 2 home visiting programs, which is Healthy Families and Parents as Teachers. So we have 2 programs that we're looking for families. If you have families that may be interested in the program, we are available. We are accepting. Does anyone have any questions?
Can you talk a little bit about, say, the parenting program? What are the qualifications? Is there an income qualification? Is there a county qualification? Is there how does someone qualify?
Right.
And just a little bit about what the program entails, because in all of us deal with families of some kind. And so I think there could be potential partnerships, but just knowing how to refer, what the qualifications are, and those kinds of things, please.
Yes, so it is a self-referred program. We are out in different entities such as the Piedmont Hospital. We were in some doctor's offices, but of course, pandemic kind of put a halt on that. But as far as the qualifiers, they could be receiving Medicaid, they could be receiving, or it could be dealing with mental health. So depression, any psychiatric conditions. It's no set guideline, no income requirement. If they are willing and open for us to come into their homes, then we are ready and willing to support. There are different targeted areas that we support. We do, we connect them to community resources. Our overall support is to help them for school readiness. So we're starting at the early age of 0, where we're tracking growth and development skills. So that is how we are supporting our families. It's a one-on-one home-based.
Okay. Now I have a question. What if one of our families happens to be in one of our emergency shelters, or in one of our transitional programs, or in one of our rapid rehousing I'd say emergency shelter and transitional, because it's not their own home at that time.
Right. It's not
But
permanent
you
housing.
still could benefit from services. What would that look like? Would that
As
be
long
allowed?
as they are in the Muskogee County area, we are able to serve those families. We come where they are. If they do not, if it's allowed with the agency, we will come there.
Okay, so now that I keyed that up, I'm hoping some of our providers are going to get some thoughts going there, because I know we often wrestle with how do we get all the services to the client. Transportation's always an issue with our clients. So that we've knocked down that barrier now. I'm looking at Ms. Hall here, thinking about public housing and how that could benefit some of their residents when we're talking about the Ross program and those other things, and self-sufficiency and those kinds of things. So thoughts, guys?
And I also want to mention, as you asked about the referral process, we have a referral form, and I can also send that out.
That would be great.
Right, and the agency can refer. And like I said earlier, it can also be self-refer. It's a voluntary program. It's free, no charge.
That's wonderful. If you'll send it out, I'll make sure it gets out to everybody and we get it also posted on our next newsletter. Question, you mentioned something about finance. And I'm changing subjects a little bit because much of what we do is educate folks on how to deal with what they have now, how to manage what they have, how to grow it, and how to become, savers and become upwardly economically mobile. That didn't come
Right.
out right, but you know what I meant. Yes.
I do. That is under our Family and Consumer Sciences program. And unfortunately, right now, we're without that person. But
Okay.
yes, that is a topic that they will address, financial management.
Perfect.
And we are hiring, so that's another thing to kind of blast out. I am looking for a family support specialist, which is we call it a home visitor, who would be trained to support our families that we're serving. And I
If
can
you'll send us
also
out the
share
listing, we'll
that
send
too.
it out. We'll push it out for you too.
Yes.
So, now I can keep asking questions, but I was hoping, y'all putting in the text in the comments here. Jamie Lee, thinking about your folks.
Yes, ma'am. So she answered my question. I'm just going to be looking out for an email with a referral form. I think that those services would be really valuable to some of our women at our women and children's shelters, some of our families at our family shelters with kids. So I'll definitely be looking out for that referral. Would it be more helpful for us if we have a group, let's say maybe 2, 3, 4 moms with kids at a time, for us to reach out, maybe a case manager or a shelter manager to reach out to your agency and maybe have somebody come out to meet with everybody at one time?
Yes, our other parenting support program, they have done that in the past. The Healthy Families program is more of a one-on-one, but we could collectively do it as a group starting out, but then it would phase into that
Sure.
one-on-one. Mhm.
Sure. Yeah, that makes sense.
Yes.
I don't know that right now we have a big group like that.
Okay.
But just for in the future, I was kind of looking for, but I'll definitely be looking out for a referral. Thank you.
Yes, ma'am. Thank you.
Ms. Jones, I don't mean
Yes.
to steal your thunder, but I want to say good stuff about your program. My grandson, oh God, he's in the background, who went through
Hey, babe.
through parents as teachers. And of course, it's like an individual one-on-one, but like every month they would have like a huge activity where they invited all the parents to come
Yes.
in, and they would do some of the things that, they do like individually. And it was always a lot of fun. And it gave the kids opportunities to learn, to get to know each other, but it was also really a great icebreaker for parents too. So for those of you who are thinking about it, I definitely highly recommend it. It is an amazing program, and it was one for our family.
Yes, thank you for sharing, because yes, the program Parents to Teachers, they do offer those monthly groups. And for Healthy Families, we do ours quarterly, but yes, it does build those social connections for parents to connect with one another.
Thank you for that, Melinda. So talk if you can about, and I know it's Miss Claudia's department, but talking about the food preservation and those kinds of things, is that very similar to, and I'm going to date myself, back in the 80s, there, we called them the 4-H ladies. I don't know what the proper title was, but they used to go, at that time I worked in public housing, and we had Miss Naomi Green was the one in ours. But anyway, she would come in and she taught the moms or the heads of household how to use the commodities boxes, the cheese, the butter, the rice, the peanut butter, how to use it, make all kinds of different things with it, how to stretch it through the month, but also how to take their food stamps and their WIC and sort of like layering it on top, how we could, yes, I said the 80s, Asante, how we could usually use it to better feed the family more nutritious, balanced meals, but also by stretching the budget. Is that what the food program that Miss
You did
Claudia
say
does?
that. Yes, you explained that quite well. That is exactly what she does with the expanded food and nutrition and education. There are some times where she has classes where she's teaching budgeting, how to use canned foods if it's not affordable, just tips on how to use different recipes. Yes. In a cost-effective way.
Right, right.
And it's a
That-
I want to say, if I'm not mistaken, it's a 6 weeks course that
Okay.
they would participate in.
So is that going to you or Miss Claudia is going to them?
It's going to Miss Claudia. It's called the Expanded Food and Nutrition Program.
So the location would be at your building?
Yes.
So I'm gonna challenge for something. I'm just full of asking for stuff. What if we had, like Jamie Lee was saying, we had a group, for instance, at one of their shelters, they have a large kitchen.
Yes. Thank
What if we could host something in a central location because transportation is an issue? Maybe we could do some rotating group. I don't know, just throwing that out there.
Right. She does go out into the field to connect with and do those classes for certain groups and individuals. So I will reconnect Claudia so that
Sure.
she can give you the outline. But yeah, she has gone out to talk with. So it would be a great way, Miss Pierce.
Yep, I would be very interested in making that connection. We've got women and children's shelter that these ladies could really use that. That would be great.
And I don't know that there's not one of us that probably couldn't use it, to be honest with you. I would just like to do there because, big girl.
It's pretty fun.
Yeah.
I learned some new tips and recipes.
Yeah, and I think trying to make sure that we're giving everybody absolutely every tool, if we're teaching you how to manage your money, but we don't teach you how to manage your nutrition and your food, and all of those things come hand in hand. We know, because if one of those pieces is dropped, our client is back at our doorstep with the need. So, anybody else? Miss Andrea, do you think maybe this might be beneficial? I don't know if you're able to talk, I think somebody over there was having some audio earlier. Tiffany, what are your thoughts? Anybody who has a housing program or a shelter? Josh, Jessica, and your outreach with your folks, maybe even.
I think we already have Miss Claudia. We have a Miss Claudia that comes and does a nutrition class with our ladies. I don't know if it's the same Miss Claudia or not.
I bet you it is.
It may be.
Oh, so
But
you're
yes, I
showing
did
off,
have a
Tiffany. You
question.
had her first. Okay.
Right. I did have a question, like with the Helping Families program.
Yes.
Is there an age limit or requirement for our clients that have children?
No age limit for the adults. We do have a window to accept families or accept the children. So it is an age bracket there. So Healthy Families, we typically enroll families who are prenatal up to the 2 weeks of birth, but we can extend it for a month or 2 months. And then the Parents as Teachers program, they accept the children up to age 3.
Gotcha. Okay.
Hey.
Hey, Asante.
All right, so for those of us who do not have a housing program, like myself, we're healthcare, but we still service families and women and children. Is there a way that we can still take advantage of the program?
Yes, we would love to become a collaborative partner where we could come to you all. We have had our First Steps coordinator, and she would go out into the field and connect. And also, we've been in doctor's offices prior to the pandemic where we would have a space, and every prenatal mom that come in for their appointment, we are able to screen them and talk with them about our program. And once again, it's a free and voluntary program, so they had the choice. We don't make them or force them, but we was able to set up in the agency to share, but we can also send over the referral form as well. And we have a fax number and we receive and check that daily.
And I'll just get with you then to see what we can do to customize something.
Okay.
Because I think that sounds like it can work.
Yes, perfect. Thank you.
That's really great. And again, that reminds me of a program we had at Piedmont years ago. It was still the medical center. You've got visits immediately after birth to make sure that everything was settling. It was more from a medical standpoint, but it was paid by Medicaid from a grant for social emotional awareness and to prevent SIDS and actually to prevent child abuse. So you know, all of it comes hand in hand with the more education, the more support folks have, I think the better. Wonderful. Other thoughts? Ms. Mary, how do you think maybe this could benefit or collaborate or coordinate with some of the things maybe the Pastoral Institute is doing or will do?
Yeah, I was just thinking about that, you know, and Asante, I appreciate that you were asking because I had sent some resources that I run across that were all about collaborative and comprehensive wraparound support, and this is right in line with that. So it's really great to learn that these resources are available. Just like Asante and Valley Healthcare, we're in the same situation where we may have people coming in for mental health services or be partnering with our partners at Safe House and Open Door, working with families that could benefit from these resources as well, and could possibly look at hosting some kind of information session, or at least at a minimum, making our clinicians aware of the resources so that they can, that we could kind of start that referral process if we felt like we had clients that could really benefit from these resources.
Thank you. That's great. And I think this is the perfect example of when we're say wraparound services. You know, we say that lingo a lot, but then you say, well, what does that really mean? Define that. And everybody sort of gets that blank look at their face. But it's anything that can enhance the quality and upward mobility of a family, whether that be an individual or a household with, you know, more than one occupant. I think that's what we need to come to grips with, that wraparound services mean. You want to say something, Ms. Jones?
No, I was just agreeing with Mary.
Okay.
Because just like, you know, you all have the collaborations, we're constantly like referring families to all of these resources in the community, because that's another portion of how we support our families. So it's good to connect with the resource, the agency itself, because sometimes there's not funds available. Sometimes, you know, and we don't want the families to keep hitting brick walls. So that was a great point. And that's why I'm on board. Yeah.
And I'd love to add to that, Pat, when you say that there's not funding available. So we have just recently in the past year expanded our HOPE funding, which is based on up to 300%. So we're trying to cover that ALICE population, 300% of the poverty level, where our donors are supporting mental health services for our community. So any of our agencies, any partners, any of you on this call, if you have candidates that need service and that funding or ability to pay is the concern, please reach out to me, because we have an application process that is in place for that now.
Okay. Wonderful.
You.
Thank you. Thank you for sharing that, Mary. Any questions for Mary about that? Okay, great.
Yes,
Actually, go ahead. Yes.
This is Frank Brown from Mother
Yes,
Mary
sir.
Mission. Mary, can you send me your contact information, or Pat, maybe I can get it from you?
Yes, Pat. Yeah, please feel free to share that with the group and in our minutes. and I'd be happy to talk to anybody about it.
Perfect. Yes, absolutely. That's wonderful. And it's a wonderful segue to something else I was going to bring up. And I'm going to let you guys see my cheesy graphic for just a minute, and then we're going to just talk again. We've been in discussions with our, where did it go? All right, let me go back to the slideshow. Emergency solutions grants. Let me go over this real quick. Emergency solution grant applications are going to, I'm sorry, I clicked too many times. I apologize. Are going to be open in April 8th. So be on the lookout for those if you want to apply. They do have a few more, these are February. They do have a few more March, sorry, tomorrow, next week and the week after workshops. You were applying for emergency solutions grants. This is what I wanted to get to, my graphic. It was really cool. I was very impressed with myself. But what we're saying with this graphic is we're having discussions with ClientTrack, which is our HMIS provider, our software provider that we use to track all of our services and enrollments and spending and those kinds of things for our homeless service providers. But we all know that we all have other funders. We all know that we have other collaborations, other coordinations, other folks that we would like to coordinate with, collect and share data with, report on, analyze. But my system doesn't talk to your system, which doesn't talk to this system, which doesn't talk to this system. There is something called Client Insight, which is this graphic here. All the agencies dump into what's considered, for lack of a better term, a data warehouse. The software engineers are doing their magic, and then we can all share the data that we need to be able to serve clients, to be able to see which client is being served, where, and how we can complement and not duplicate services. Also, all of it is HIPAA compliant and the like. And I wanted to give folks the opportunity to say, hey, I'd really like to be part of this discussion. We're putting together a list of providers that want to come and see a demonstration from the software provider, whether you're, a healthcare system, which most of those have already signed on to say, yeah, they wanted to be a part of the discussion, or you're, a cooperative extension service, or I added some more earlier today and now I can't remember them. We were talking with our folks who are doing some grant work for the Chips for Chips, and we're looking at having other entities, other funders, poverty reduction, those kinds of things included. So I'd like to have just a brief discussion, not going to keep everybody very long. We do have some announcements of some upcoming things going on, but discussion about if there's an interest in you joining the discussion, or at least the demonstration of what sharing of data might look like, and some other successes that have happened in other communities of sharing of data, meaning you're not doing duplicate entries. Yes, Jamie Lee, I know you just smiled. You're not doing duplicate entries, but we're all still being able to share the information. And now I get crickets.
Yes, send me an email. I would love to be a part of that.
Same here.
All right. All right, so what we'll do is I'll add adding Mother Mary, and adding Chattahoochee Valley Jail Ministries. Actually, I think you were on the initial list that we came up with anyway, Jamie. I think all housing providers were, because we already using HMIS.
Right.
But so if you want to be included, just let me know. And we're talking, this is probably a month or so out, because we're putting together the list. We've told the software engineers that if we're looking at it, if they were going to do a mock-up of what it would look like maybe for our community, we're looking at system performance measures, APR measures, and social determinants of health. For those of you who are not in the homeless service provider arena, we know a lot of your work, your outcomes are measured on social determinants of health. So just really want to make sure we have a robust meeting and that we bring folks in at the beginning to start having the discussions. We all know that none of this happens overnight, but having these discussions and looking at it from a perspective of what's already been done. So we're not reinventing the wheel, we're just polishing it up and maybe making our wheel, instead of aluminum, it's chrome. So.
Hey, Pat, this is Mary Johnson. Will you add me to that list as well?
Yes, ma'am, Miss Mary. All right, so moving right along, we've got a few slides to go through, folks, and we are going to be done. Oh, I need to share again. I'm sorry.
Hey, Pat, I had a question, on that meeting invite, about, Take the City. So for resources like that, I think they would probably be interested.
Absolutely. I'm glad you said that, because also when we're talking about, you know, telling our stories in the community, but also from a perspective of if we're trying to write a grant or whatever, being able to look at data for our community and drill down on it, I think would be vastly important for all of us, and looking at because, you know, having to have it and show comparison from year to year in this, and so we're collecting it and analyzing it the same way each time. So Vote Riders is it first Thursday in the morning at Home for Good, and the third Thursday in the evening. Our April navigation meeting will be in person at First Presbyterian. And if you remember at our semi-annual meeting, Chance Corbett from Emergency Management and Jack Lockwood from Department of Public Health had spoke about getting together a meeting of community organizations to talk about how we respond in a disaster. You know, excuse me. That meeting will be March the 29th from 10 to 1. They're feeding us all at the Piedmont Columbus Regional Conference Center. I will ask that, you know what, I will forward the invite to everybody here. So I won't need to ask them to send it out. I will just forward an invite to everybody here. Everybody that we invite to navigation to come to that meeting so that we can collaborate and talk about how we respond in disaster in our community. Our Goodwill calendar, and I will send everybody the link to this whole calendar. They got events almost every day going on, if not every day. So making sure that all of us are aware, making sure we make the connections with our provider. And yes, actually Goodwill is going to be part of the discussion of sharing of data. There's a Medicaid recertification event on March the 19th at Victory Mission on North Lumpkin Road, sponsored by AmeriGroup. There's a flyer, and I could send out the separate flyers. We have them in English and in Spanish. Medicaid recertification, you know, people are dropping off because they're forgetting to recertify. They've moved their address, you know, any kind of thing. They didn't get it in the mail, or there's, for some reason, their response got lost. Making sure that everybody recertifies their Medicaid, because once it's lost, getting it restarted, we all know is a headache. That's all I have. Anybody else? Announcements, big things going on at your organizations, something you need everyone to know?
Hey, Pat.
Yes.
We have a healthcare going on in Waverly Hall on March 16th. I put the flyer in the chat box.
Perfect. I'll go ahead and download it now, and when I send everything out, we'll include it.
Thank you.
Hey Pat, this is Chloe.
Hey, Miss Chloe.
I just wanted to share New Horizons is getting a mobile unit soon. We're pretty excited about it. We're going to be offering free rapid and confidential HIV, Hep C, and COVID testing. And right now we're still in the early stages, but I'm just building the schedule for events that we do know of in the upcoming months. We're hoping by April sometime to have it up and running and actually going places. But I'm going to put my email in the chat if anyone has any suggestions for events, or also like for like a maybe a monthly or bi-monthly like routine thing to come to your organization or wherever in the community, I'd love to get you on the schedule. So I'm gonna put my
Perfect. Perfect. Anybody else? I'll give you back almost 20 minutes of your day. So just to confirm, I have to send Coach Brown, Mary Johnson's contact information, add Take the City, Mother Mary, Chattahoochee Valley Jail Ministries, and the Pastoral Institute to the discussion about sharing of data. I will forward the invite for the meeting with Chance about community organizations active in disaster. And Chloe, you've put your name, your contact information in the chat for folks who want to collaborate or partner on having the mobile unit come out to their location or their organization. All right, with nothing else, we got 30 seconds. If you speak now or forever hold your peace. All right, see you guys. Bye.
Have a blessed day.
Thanks, Pat.
Thanks, Pat. Bye, everybody.
Bye.
Bye.